Hello everyone, it's May 2nd. I'm Dr. Adam London, Director of the Kent County Health Department, enjoying the great outdoors this morning, and I hope all of you have plans to get outside this wonderful weekend as well. Across the state of Michigan, there are now 42,356 cases of COVID-19. That's an increase of 977 over yesterday, and 3,866 deaths, which is an increase of 77 over yesterday. Here in Kent County, we're now at about 1,700 cases of COVID-19, which is an increase of about 100 over yesterday, and we're still at 36 deaths countywide. A lot of questions from people about what's the big deal, and we've been suffering and sacrificing so much for the past month and a half, and yet our case numbers are so low, and it doesn't seem like this was really as big of a deal as what it was originally said to be. And I just want to be as clear as possible that the reason why it doesn't seem like it's that big of a deal in Kent County and throughout West Michigan is because all of you have done your part to make it not a big deal. You've all done your part to make it difficult for that virus to spread person to person. So as a result, we have seen much smaller numbers than what we would have expected had no restrictions been put in place. But even with these precautions, COVID-19 across the U.S. is still one of the 3 leading causes of death day to day. But unlike the other 2, cancer and heart disease, coronavirus is contagious, and it could get a lot worse if and when these restrictions are removed. And to be clear, I think that we need to loosen our restrictions. We need to reopen the economy in a smart way. We need to get back to work in smart ways that are as safe as possible, that make it as difficult as possible for the virus to spread, while also making sure that we're protecting against other concerns that we have: depression and mental illness and suicide and substance use and domestic violence and all the other things that we know are risk factors and concerns during a time of such unusual circumstances that we have right now. But it's going to be important that even as we reopen the economy and get back to work, that we're being as smart as possible in doing that. And I'm going to profile day to day one of the things that we need to keep doing. And today, I want to mention masks. Such an easy thing, such a low-cost thing that everyone can do. Wearing a mask when you're going into public, into buildings in public. And it doesn't cost anything. Now, we don't really know how effective wearing masks are in preventing the transmission of the coronavirus, but it certainly is an easy thing to do. It probably reduces the spread somewhat, and that should be good enough, because we need to all do the easy things if we're going to be able to do the big things. I also want to encourage you to ask your kids what questions they have, and please forward those questions to us in the comment section below. My wife and I, we have altogether 7 children ranging in ages from 1 to 23, and I know they have lots of questions, and we've had lots of conversations with them, and as this pandemic switches from one phase to the next, the questions change. So keep having those conversations with your kids, and please let us know if there are questions that we can help you with, because we want to do that as much as possible and encourage you and them to stay positive, stay heroic, stay healthy. Send us your questions, and we'll address them as best we can. Thank you for watching. I'm Dr. Adam London, Director of the Kent County Health Department, and I'll talk to you again on Monday. Thank you.